If you love your penis, this video is for you. I'm Dr. Jocelyn, urologist and pelvic surgeon, and today we are going to talk about 10 things you should never do to your penis. Men, as a urologist, a big part of my daily work is taking care of penises. This is what comes into the office. This is what shows up in the emergency room. And this is what worries many of you in silence. And quite frankly, penile health matters deeply. And it should matter to you as much as it matters to me. In this video, the goal is simple. Walk you through 10 essential things you must do and must avoid to protect your penile health, many of which most men have never been taught. Stay with this until number 10 because that one tends to surprise a lot of guys. 1. Don't ignore your penis. The first one sounds almost too obvious. Do not ignore your penis. Most men only pay attention to their penis when they are about to have sex, something feels wrong, or they are comparing themselves to someone else. But medically, the way your penis functions is one of the best barometers of your overall health. There is a very important statistic here. When you follow men who start having persistent trouble with erections, not one bad night, but ongoing erectile dysfunction, and track them for about 7 years, around 14% of them go on to have a heart attack. Erectile dysfunction is not just a bedroom problem. It is a warning signal. That is why in medicine, ED is often called the canary in the coal mine. When you have good, strong erections and good desire, that tells us several things. Your blood flow is working well. Your hormone levels are likely in a reasonable range. Your nervous system is functioning properly. Psychologically, you are not under overwhelming chronic stress. You're probably not abusing substances that damage blood vessels and nerves. So when your penis stops working the way it used to, do not shrug it off. Do not just blame age and move on. See it as your body speaking up. The sooner you listen, the more you can protect not only your sex life, but your heart, your brain, and your long-term health. 2. Don't DIY treatments for your penis. Number 2, do not experiment with do-it-yourself fixes on your penis. There is a powerful combination that drives men into dangerous territory: insecurity, silence, and the internet. When a man is worried about size, performance, or appearance, he often looks for quick fixes in the shadows: forums, random videos, anonymous before and after pictures. That is where the so-called home remedies and miracle tricks live. Let's be very clear. There is no safe homemade method that will make your penis longer or thicker in a meaningful, permanent, and safe way. No oil, no cream, no random kitchen ingredient is going to grow your penis overnight, regardless of what an ad or a stranger on a forum promises. One of the more absurd things that circulates is the idea of pouring apple cider vinegar or other acidic or irritating substances onto the penis to stimulate growth or boost testosterone. Besides not making any physiological sense, this can cause burns, irritation, and injury. There is also jelqing, which many men hear about online. Jelqing involves using your hands and strong pressure to stretch the penis in the belief that it will increase length or girth over time. The problem is, when men do this especially aggressively and frequently, they can cause repeated microtrauma to the erectile tissue. Over time, that trauma can lead to scarring, curvature, pain, and ultimately erectile dysfunction. Every urologist has seen young guys who went down this path because someone online guaranteed results. And men rarely do things lightly when they believe something might fix their deepest insecurity. They push harder, they do it longer, they go to extremes. And then they end up with damage that cannot always be reversed. So the message here is simple: do not jelq. Do not apply aggressive mechanical force to your penis in the hope of changing its size. Another dangerous category is homemade constriction devices. Constriction rings, when properly made and used, can be helpful tools for maintaining an erection for some men. They are designed to be flexible, removable, and safe when used correctly. But every year, men end up in emergency rooms because they improvised. There are real cases of men placing metal nuts, rings, or rigid plastic pieces around the base of the penis to trap blood, and then being unable to remove them. Once the penis swells, those rigid objects become prison bars. At that point, it is not a joke, it's a medical emergency. To remove those, sometimes fire department tools or specialized saws are required. The longer the device stays on, the higher the risk of permanent damage. If you think a constriction ring might help you, buy a proper medical or sexual health product that is designed for that purpose. They cost very little compared to the cost of an emergency surgery or permanent loss of function. The principle is this: your penis is not a DIY project. If something worries you, talk to a professional instead of experimenting on your own body. 3. Keep it clean, but not abused. Number 3. Keep your penis clean, but treat the skin with respect. Most men understand they need to wash their genitals. The trouble is more in the details, especially when there is a foreskin. If you have a foreskin, you must regularly pull it back gently, wash underneath, rinse well, and dry. If you never retract the foreskin, sweat, skin cells, and secretions can collect and form smegma, which can lead to irritation, bad odor, and infections such as balanitis, which can be painful and uncomfortable. There is another important reason to make sure you can retract your foreskin fully. While penile cancer is rare, when it does occur, early detection matters. If the foreskin is so tight that you can never see the head of the penis or the skin underneath, early lesions or abnormalities can be hidden for years. So if you cannot pull your foreskin back at all or only with pain, that is not just an inconvenience. It is a medical issue called phimosis. Talk to a doctor or urologist. In many cases, topical creams, stretching, or minor procedures can help. In some cases, circumcision is the best option. But living with a foreskin you can never retract is not a healthy long-term plan. On the other side of the spectrum is overcleaning. The skin of the penis is delicate. You do not need harsh, heavily scented soaps or aggressive scrubbing. These can strip away natural oils, irritate the skin, and even cause micro tears. So the plan is simple. Use mild, unscented soap. Let the soapy water run over the area. Clean gently. Rinse thoroughly. Dry the area, including under the foreskin, by patting, not rubbing. You are aiming for clean, not sterilized. Treat the skin as you would treat the skin of a sensitive area you care about, not like you are scrubbing a dirty pan. 4. Don't ignore pain or warning signs. Number 4. Do not ignore pain, lesions, or other warning signs. Many men have a high tolerance for denial when it comes to their genitals. Pain when urinating, burning, discharge, warts, ulcers, bleeding. All of these can appear, and some men will still tell themselves it will go away for weeks or months. Pain, swelling, changes in color, lumps, or sores on the penis are messages from your body. They are not there to be ignored. They may signal a sexually transmitted infection, a urinary tract infection, a kidney stone or bladder stone, especially if there is blood in the urine, a skin condition, and in rare cases, cancer of the bladder or the penis. Penile cancer, again, is rare, but when it appears, it tends to be aggressive and devastating if ignored. Some of the saddest cases in urology are men who noticed an ulcer, a lesion, or a growing lump on the penis and said nothing for months or years out of fear or shame. By the time they finally seek help, the treatment needed is far more aggressive than it would have been early on. If you feel judged by a doctor, find another doctor. Your health is more important than anyone's opinion. A good physician's job is not to judge your sexual history or your mistakes. It is to protect your health and your future. But that can only happen if you show up and speak honestly. When something on your penis looks or feels wrong, new pain, new sores, unusual discharge or blood, do not wait. Do not hide. Make an appointment. 5. Stay in control and stay safe. Number 5. Stay in control and always prioritize safe sex. There is nothing more attractive in the long term than sex where both people feel safe. Safe from infections, safe from unintended pregnancy, safe from being pressured, and safe from injury. When you are not worried about STI or pregnancy, you can relax, be present, and actually enjoy the experience rather than running mental calculations in the background. Condoms and other forms of protection are not the enemy of pleasure. They are the guardian of freedom. There are many types of condoms. Thinner ones, different materials, different sizes and shapes. Experiment. Find what works for your body. Involve your partner in choosing them. Turning protection into part of the ritual, rather than an awkward afterthought, can transform the experience. Beyond infections and pregnancy, there is also the issue of physical injury. One specific injury that men need to know about is the penile fracture. Technically, the penis has no bone, but when it is fully erect, the tissue is under pressure. If your penis is erect and the thrusting motion suddenly forces it to bend sharply, for example, you slip out and hit the pubic bone instead of the vagina or anus, the tough outer layer of the erectile tissue, called the tunica albuginea, can tear. When this happens, men often report hearing or feeling a pop, followed by immediate pain, loss of erection, and rapid swelling that can make the penis look like an eggplant. This is a surgical emergency. If you suspect a fracture, you do not wait at home to see if it gets better. You go to the emergency room. Without timely repair, the chances of long-term erectile dysfunction and curvature increase significantly. Staying in control during intercourse means being mindful of position, speed, and angle. It can help to hold on to your partner's hips and guide the movement rather than letting momentum take over entirely. This is not about fear, it is about awareness. Lubrication is another key part of staying safe. Lack of lubrication increases friction, which can lead to micro tears in the skin, discomfort, and makes accidents more likely. Lube is not a sign that something is wrong with your partner. Many factors influence natural lubrication: age, hormonal changes such as perimenopause and menopause, medications like antidepressants or antihistamines, stress, and individual variation. Relying only on natural lubrication can be unfair to both you and your partner. Good lubricant makes sex smoother, more comfortable, and often more pleasurable for both people. 6. Don't overheat your testicles. Number 6. Do not keep your testicles in constant heat. Your testicles are located outside the body for a reason. Sperm production requires a slightly cooler environment than your internal core temperature. When the testicles are repeatedly or chronically exposed to high temperatures, sperm quality and quantity can decrease. In some cases, this can contribute to fertility problems. Exposing your groin area to prolonged, intense moist heat, for example, sitting in hot tubs, jacuzzis, or steam rooms, very frequently and for long durations, can have an impact on sperm production. Using a laptop directly on your lap for long periods can also increase local temperature, as can keeping a phone in the front pocket right next to your testicles all day. The solution is not to fear every bit of warmth, but to be sensible. Limit the time you spend in very hot environments like jacuzzis or steam rooms. Place a pillow or stand under your laptop instead of setting it directly on your lap. Whenever possible, keep your phone in the back pocket or bag rather than pressed against your testes in the front. If you are trying to conceive or know you have fertility issues, being mindful of testicular temperature is even more important. 7. Be kind when you masturbate. Number 7. Be kind to your penis when you masturbate. Masturbation is normal, healthy, and part of most men's lives. The problem arises when the way you stimulate yourself trains your brain and body to expect a very specific, extremely intense type of stimulation that no partner can realistically replicate. One example is what many call death grip. This is when a man masturbates with a very tight, intense grip, and often very fast, sometimes combined with strong pressure focused on one specific spot. Over time, the nerves and brain associate orgasm and arousal with that exact pattern. Then, when that man is with a partner, a vagina, mouth, or anus, the sensations feel too soft, too different, or not enough compared to what his brain is used to. He may struggle to become fully aroused, to maintain an erection, or to reach orgasm. He might interpret this as performance anxiety, a problem with the partner, or fear that he is broken, when in reality, his own habits have conditioned his responses. Being kind to your penis means choosing masturbation techniques that are closer in intensity and rhythm to what you experience with a partner. Use lubricant. Take your time. Avoid squeezing as hard as you physically can. Allow your body to experience pleasure, not just chase a fast release in secret and shame. Also, try to move away from the idea that masturbation must always be rushed, hidden, and surrounded by guilt. The more shame you wrap around your sexual self, the more anxiety tends to appear later in partnered sex. 8. Don't smoke and protect your health overall. Number 8. Do not smoke and take your overall health seriously. If there is one lifestyle habit that repeatedly destroys erections, it is smoking. Smoking damages blood vessels throughout the body. Your penis depends on healthy, responsive blood vessels to get and maintain an erection. Over time, smoking narrows and stiffens those vessels, making it increasingly difficult for enough blood to flow in and stay there. Erectile dysfunction in smokers is extremely common. Smoking is also strongly associated with bladder cancer, one of the most challenging cancers to manage. Treatment often involves repeated procedures looking inside the bladder with cameras, removing tumors, and in serious cases, major surgeries that change the way you urinate for the rest of your life. Your erections are not separate from the rest of your body. They are a mirror. Good cardiovascular health, good metabolic health, and good mental health all support good erectile function. Remember the statistic from earlier? In 7 years, about 14% of men who develop erectile dysfunction will have a heart attack. Erectile dysfunction is a biomarker of vascular health. So, what supports both your penis and your heart? Eating a balanced, healthy diet rich in whole foods. Avoiding smoking and minimizing drug use. Moderating alcohol intake. Regular aerobic exercise to support blood flow. Resistance training to help support testosterone and muscle mass. Managing blood pressure, blood sugar, and cholesterol. Prioritizing sleep. Stress management is also essential. A little stress can be motivating, but chronic, overwhelming stress erodes health slowly. It affects your hormones, your sleep, your mood, and your sex drive. Long-term stress increases the likelihood of erectile difficulties even when your physical structures are intact. If changing habits feels overwhelming, start tiny. Build small, sustainable habits. For example, a short daily walk, one healthier meal choice per day, one step toward quitting smoking. Your penis will thank you as much as your heart will. 9. Be kind to yourself, not just your penis. Number 9. Be kind to yourself, not just to the organ. When something goes wrong sexually, men tend to turn the full force of their self-criticism onto themselves. A single episode of losing an erection, not being able to finish, or feeling off can echo in a man's head for weeks. Here is what often happens. A man has one experience where he cannot get or keep an erection. The next time he is with his partner, he is thinking about that incident. What if it happens again? What will they think? What does this say about me? That fear and anticipation triggers anxiety. Anxiety activates the nervous system in a way that actually makes it harder to have an erection. So the feared event is more likely to happen again. Now the worry is even stronger and the cycle tightens. If you respond to this by attacking yourself mentally, calling yourself names, comparing yourself to other men, catastrophizing, you are pouring fuel on the fire. Shame, secrecy, and self-hatred are not cures for erectile problems. Everyone, without exception, will have fluctuations in sexual performance over a lifetime. Illness, fatigue, stress, alcohol, new medications, relationship conflicts, all of these affect erections. One or a few off nights do not define your masculinity, your worth, or your future. Being kind to yourself means acknowledging something was off today. That's okay. Let's see if it persists. If it does, I will get it checked, but I will not destroy myself mentally over it. It also means talking either with a partner, a trusted professional, or both. Men often keep all of this inside, which magnifies the anxiety. Sharing the concern is often the first step to breaking the cycle. 10. Use it or risk losing it. Number 10. Use it or you may gradually lose function. The phrase, use it or lose it, is not entirely accurate in the literal sense, but there is enough truth in it that it is worth understanding. Your penis is not just a passive structure. It is living tissue that needs regular blood flow. Normally during sleep, men have several erections throughout the night, often 3 to 5. These nocturnal erections bring oxygenated blood into the erectile tissue and help maintain its health and elasticity. If for some reason a man stops having regular erections both during waking life and at night, the tissue can gradually change. Reduced oxygenation and blood flow can promote subtle scarring, less elasticity, and in some cases, a slight shortening over time. Men may notice that their penis looks or feels different even when they are not sexually active. In addition, desire is partly a habit. If you have ongoing low sex drive, whether from stress, depression, hormonal changes, relationship difficulties, or other causes, and you completely avoid sexual activity for a long period, your brain may start to downregulate the importance of sexual stimuli. The urge becomes weaker, and it can feel harder to wake it up again. For some men, this is not a problem. Not everyone needs or wants frequent sex, and that is perfectly valid. But if you are in a relationship where intimacy matters to both of you, or you personally want to maintain your sexual function, ignoring sexuality entirely for long periods can make it harder to return. Sex and intimacy offer many benefits: bonding, stress reduction, physical pleasure, emotional closeness, and sometimes even protective effects for cardiovascular and mental health. It does not matter how old you are. If you and your partner value intimacy, it is worth nurturing. That might mean planning time together, communicating honestly about needs and fears, and being willing to adapt your sex life as bodies and circumstances change. If you notice that nocturnal erections have disappeared, or that you never wake up with any degree of erection anymore, that is another reason to check in with a doctor. It can be a sign of underlying health issues that deserve attention. In summary, yes, there is a sense in which use it, as in keep your sexual system engaged through erections, intimacy, or masturbation, can help maintain the health of the tissue and the pathways involved. And remember, taking care of your penis means taking care of your whole self: your physical health, your emotional health, your relationships, and your habits. You are not just a collection of organs. You are a whole person. Treat yourself accordingly.